to get an update on the battle of our lifetime, the fight against the coronavirus, and also learn a little more about what's going on in state government. Today, I want to thank Paris Independent Schools for looking out for their students and for providing me this mask. Paris Independent Schools has a pretty neat set of values: pride, achievement, discipline, and loyalty. And thank you to the Board of Education and Central Office staff for everything you do, but also for keeping your kiddos safe. Today, we're going to do our Fast Four, and then we're going to get into our COVID report, which, if you take the backlog cases out of last week, will be our single highest day. What this means is that for a couple weeks, we've probably been a little casual or a little lax. And while I see people out there stepping it up, it takes a little bit of time to catch up. But again, today ought to be one of those things that jolts us into action. So I'm going to do our Fast Four because there's some good things going on in state government. We're going to give the COVID report. We're going to kick it over to the Lieutenant Governor for a couple of important announcements. And then Dr. Stack has a separate report, and we'll continue to answer questions about how we're changing our positivity rate calculation at the beginning of next week, and want to make sure everybody understands it, understands why we're doing it, and is comfortable with it, because it's important that you have accurate data that you trust. So today's Fast Four. First is supporting victim services. Today, I am proud to announce that the Justice and Public Safety Cabinet has awarded $37 million in grant funding to 133 crime victim service providers across Kentucky. These funds are a part of the Victims of Crime Act program known as VOCA. VOCA is the only federal grant program supporting direct services to victims and survivors of all types of crimes as they walk the path towards recovery. Programs awarded include state government agencies, local government entities such as prosecutor offices, law enforcement agencies, and nonprofit organizations that provide direct services to victims of crime. Funding priority is given to projects that provide services to victims of child abuse, sexual assault, and domestic violence. And while we should all be committed to ending those terrible crimes, to creating a world without child abuse, because that's possible, without domestic violence, I believe that's possible, without sexual assault. Until we get to that better world, we've got to make sure that we are helping those that have had this trauma inflicted on them, and that we remember that oftentimes the trauma extends beyond maybe that single individual that's hurt, but to children, for instance, who witness domestic violence and can carry that trauma with them their entire lives. So I want to highlight a few of the agencies that are receiving these awards. They are earned, not given, and there's some really special groups in here. First, the Lotus Sexual Violence Resource Center and Children's Advocacy Center. This is in Paducah, I believe. VOCA funding allows Lotus to not only improve safety, healing, and justice for survivors, but also to cultivate safe, equitable, just communities where all persons thrive. With VOCA support, each survivor has trauma-informed, integrated care needed to truly heal and reclaim lives. Before COVID, I was able to travel to Lotus for another grant that was helping to create, I believe, a garden space that we know can help in that healing. They're doing really great work. And I remember just about everybody from the community was there and supportive, from their judge executive to their mayor to law enforcement, everybody coming together to try to help those who need our help and maybe at their very lowest moment. It's our job to make sure we provide that support. Next group is Home of the Innocents. VOCA funding supports high-quality therapeutic services for child victims of crime residing at Home of the Innocents. The treatment team, which is funded by VOCA, consists of highly trained members bringing hope to traumatized children who have been removed from their homes, helping them heal from their trauma and create a happier, healthier path for the rest of our lives. Home of the Innocents does some really great work, and we appreciate them. Brighton Center Homeward Bound Shelter, the only shelter for youth ages 11 to 17 in Northern Kentucky. VOCA provides funds for the shelter to employ a licensed therapist and a case manager who works to stabilize the youth, process their trauma, and ensure all their needs are met. Each year for the past several years, Brighton Center's Homeward Bound shelter has served over 90 youth that are victims of crime related to physical, sexual, domestic violence, or neglect. And Greenhouse 17. Thanks to VOCA funding, they have been able to expand housing, legal, shelter, and counseling support and services, as well as sustain and expand their child visitation and exchange centers throughout their 17-county service. Also, a great organization led by someone who's a true powerhouse, wants to help those around them. Full list of VOCA subaward recipients can be found on the Justice and Public Safety Cabinet's website, and check it out. These groups are in your community. They're providing amazing services. Be a part. Figure out what you can do to help. Again, this is part of our values, part of my faith. Let's make sure we're doing what we can. Over $37 million in VOCA grant funding awarded. Of the $37 million, approximately $9.5 million will go towards providing services to victims of domestic violence. This will bring us one step closer to ending intimate partner violence in Kentucky by offering help, assistance, freedom, and resources for victims. Just this morning, I participated in a virtual press conference hosted by the Kentucky Coalition Against Domestic Violence. KCADV works hard to help survivors of domestic violence. And today I signed a proclamation highlighting October as National Domestic Violence Awareness Month, a time we set aside to make sure that everyone knows that this crime and this evil is out there, and everyone can learn how they can be a part of the solution. Domestic violence is an epidemic. It impacts over 10 million Americans each year. And in Kentucky, domestic violence resulted in 40 deaths last year. During my time as Attorney General, I worked hard to combat violence, sexual violence, violence against children. And as governor, I promise to continue these efforts. And today, with these grant announcements, we're one step closer. There is so much more to do. More awareness and more action. As for tonight, we're lighting the governor's mansion purple to honor victims of domestic violence that have lost their lives this year and show support for the work to end domestic violence. Capitol will still be lit green for those that we have lost during COVID, but this will just be the second time since the beginning, since the very first person we lost to COVID, that the governor's mansion will not be green. Tonight, it's going to be purple for these 40 individuals that we lost last year and all of those that are suffering. We hope that if any of those individuals are watching, you know these shelters are open. They are still operating during COVID. They can keep you safe. And please reach out if you need help. We care about you, and we want you to get the help that you need. All right, second on our Fast Four is the Buckle Up, Phone Down Highway Safety Campaign. One of the ways to make a better Kentucky is saving lives on our roadways. And two ways we can save lives are using a seatbelt and eliminating distractions. One of the most obvious distractions is your cell phone. So our Kentucky Office of Highway Safety is partnering with the National Highway Traffic Safety Administration to drive home a safety message. Buckle up and put your phone down. We're convinced that these two simple solutions can save lives on our roadways. Research indicates distracted driving is a factor in more than 50,000 crashes, 15,000 injuries, and about 200 highway deaths every year in Kentucky. In addition, more than half the people killed in vehicles in Kentucky each year were not wearing a seatbelt. We need to do better, and we can. All this week, you're going to be seeing and hearing on radio, TV, and digital advertising ads that promote Buckle Up, Phone Down. There's also a dedicated website, kyhighwaysafety.com, where you can get more information. Each of us, just like in the decisions that we make to protect people from COVID, have decisions that we make that can protect people when we're driving. So please, buckle up and put your phone down. All right, next one on our Fast Four, vote. Vote. Okay, we are now past the time where you can request an absentee ballot, but if you have requested it, make sure that you either send it in or drop it in a ballot drop box. Then get online at Go Vote KY and ensure that it has been received by the clerk in your county. It is that easy, not only if you've already gotten that absentee ballot to vote, but also to make sure that your ballot was received. Now, our early voting has started, and we saw yesterday and today some significant turnout for early voting. Remember, you have a little less than 3 weeks and have some Saturday hours. Make sure you make your plan. Think about right now, what day this week or next week or the one following are you going to go? What time are you going to go? How are you going to get there? Those are all the steps that you take to make a plan to vote. And it's never been easier. And this is going to make it really safe. Pick a time where there won't be as much density and make sure that your vote is counted. We really want a record turnout. No matter who wins, who loses, I think our state shines if we can have that record turnout with all the different ways that we can currently vote. It's easier now than ever. And if you turn out in those numbers, I think it'll convince our lawmakers to put these procedures into state law, because it's not a Republican or a Democrat thing. It's just easier for everybody. And we should all want everybody who qualifies to vote to actually vote. This is one of your duties as an American citizen. Get out there and vote. All right, and last is Mask Up KY. When we encourage everybody out there to wear a mask, which is what helps us to not have to take other drastic action. It helps us protect our economy, helps us protect our children's education, and it helps you save lives. Little things like wearing a mask make you a hero. And we've received a couple questions about this pumpkin and the mask that is on it. And there's actually a story behind that. So Rocky, my senior advisor, had the idea to carve a pumpkin for our staff for them to enjoy as they walk into the Capitol. Thanks to Kathy, our on-site nurse, and her husband who carved it, we now have an official Team Kentucky jack-o'-lantern masked up and following COVID-19 guidelines. I want to give a special thank you to Kathy, Wayne, who is security, he's in the next picture, and Mona, our other on-site nurse, for their kindness, fun spirit, greeting us with smiles every morning, and setting a good example by wearing masks, as well as spreading our Mask Up KY message on their shirts. We appreciate your dedication to ensure we stay healthy at work and they have fun while doing it. And Kathy and Mona, I miss you every morning when I come in. You have such enthusiasm. You brought something really special to the Capitol while keeping us safe, temperature checking everybody as they come in. We really do appreciate you, and I can't wait whenever I'm cleared to be back and to be able to say hello. All right, but because they're working over at the Capitol, they don't qualify for the Mask Up KY competition. That's when we find some of the best that is out there on social media, because the vast number of people are doing the right thing, and we want other people to see that. So today, we have our 3 winners that we'll be reaching out to provide a Team Kentucky mask. So the first one is Diana, saying that this is normally her fall vacation week, but they are staying local. We appreciate them masking up. We also appreciate the decisions that they are making. All right, next is Dave in Northern Kentucky. They had to wait 35 minutes to vote today, which means we're having good turnout thus far, but says it was well worth it, and he is masked up. And let me say, the pictures that I am seeing of our precincts, our early voting centers, we are seeing people spread out. We're seeing their masks on. Listen, this is the type of behaviors that we got to show and do, how we protect each other and protect those poll workers. It's a really good example of what we can do. Now, I know some other people did travel for fall break. And if you did, we need you to do the responsible thing. And that's get everybody tested, especially before they go back to school. So Anna Marie is showing us exactly what that's like and the responsibility. They traveled for fall break. So before they send their kids back to in-person school, they're doing the responsible thing and getting them tested. Listen, I have a 10-year-old. I know what it's like as they are getting tested. But it's really important, especially if we do some these things like travel, that before we could potentially expose other people, go get a test. They are available, and I want to thank them for doing it. All right, so we got to stay positive because we're going to get through this, and we're going to get through this together. But how many people make it through with us is so critical. Now, I just got a letter from an individual in the media who lost one of his parents, and there were a lot of thoughts in there and some things that we probably need to look at on visitation. But just you could feel the emotion of how tough, truly tough it is watching a family member go through this. When it's very difficult to go see them because of the potential spread of the virus and the amount of PPE that's necessary. And so we're not just losing people, we're losing people in a way that's really lonely for everybody. That makes closure harder. And then, of course, the funerals also difficult. And we're now starting to see a lot of spread in funerals where the guidelines aren't being followed. And nobody wants that as part of a remembrance of a loved one. So please wear your mask, follow social distancing, follow those top 10 rules, because this is heating up all over the country. I believe that they call this the second wave. I think it's the third escalation. You know, the first was in the very beginning, and you saw it devastate New York, New Jersey, Louisiana had it rough, and we had started up increasing, but then Healthy at Home helped us to level off. That second escalation occurred really in July and moving into August. And that was because we were out and we were doing more and our economy was reopening. And that was real concerning, but we passed that. We put into place the mask mandate. We took some other precautions for a certain period of time. We have some more and better information from the CDC and others to help us make these decisions. The White House provided guidance, and we were able to stabilize there. During that time, it was Florida, it was Texas, Arizona, and to some degree, Alabama, Mississippi, and South Carolina that bore some of the brunt of it. And in each of those instances, at least in a couple states or major cities in those states, hospitals ran out of room. And we're seeing that now in places like Wisconsin, that it's gotten dangerous, and the Dakotas. We're seeing a third major escalation. And we as Kentuckians have been able to step up each time so that we are not one of those 4, 5, 6 states that get hit that hard. But we have almost always been right on the cusp, right outside of the woods, you know. And so we got to make sure that we do the same here. The White House thinks on their incident rates that right now we're about the 12th in the country. In the highest, I actually think we're a little bit lower than that because they pull their information from our pre-audited forms where we go back and ensure the numbers are as accurate as they can be. But still, it's really hot right now. Everybody should know somebody or business or an organization that either has it or has had to shut down for a little bit. It's to that level. And if we don't do what it takes now, that level is going to be way too high moving into the fall and moving into the winter. And today's report is an example. We have 1,346 new positive cases of COVID-19. There's no backlog in that. That is today's numbers. Those are recent tests and positives. It is an indication that right now, at least we're finding more virus out there, and there is probably more virus out there than any time to date in our dealing with this pandemic. If you take out the backlog cases that came in last week, I think a week ago from Lexington, this would be our single highest day. That's not where we want to be right now. So we've got to stop this third escalation. And then with the levels that it's on right now, well, we've got to start seeing decreasing cases. So I've said wake up call before. Maybe this is a jolt or a shock to the system, but everybody ought to be concerned. and everybody ought to be doing the right thing. And those that are out there that try to confront you for wearing a mask or being a jerk, that's all they are. And they're putting your health at risk. So do the right thing. The vast majority of people are with you. Let's keep it up, and let's know that we've got to step it up a little better and a little better each day. Let's push the complacency out. Let's get the urgency back in. 171 of the 1,346 cases today are kids under 18. You want another reason? More kids are getting this. And with us not knowing about the full long-term impacts of this, let's mask up and let's knock our numbers down so there are fewer kids that have to go through this. Brings our total number of cases since the beginning to 83,013. We've tested now 1,718,621. Those aren't Kentuckians. Those are total tests. Some people have had multiple tests. Today, we have 711 Kentuckians in the hospital. That's up from 704 yesterday. Currently in the ICU, 185 Kentuckians. That was just 170 yesterday. So we are seeing a concerning increase there. Currently on a ventilator. This one hurts. 113 Kentuckians. It was 90 yesterday. So while we still have capacity in our healthcare system, we are seeing increase in hospitalizations, increase in the ICU, increase on ventilators. And sadly, if we continue to have this amount of cases, we will see an increase in death. So think about it this way. If we do the right things, if we protect one another, we knock down the case numbers, which knocks down the hospitalization numbers, which knocks down the ICU numbers, which knocks down the ventilator numbers, which saves people's lives. I know we can do it, and I know we will do it. Our test positivity rate, 4.72% today, and Dr. Stack, I know, will talk again about how we will be changing the way that we calculate it, but he walked through that yesterday, and we believe that it's just going to make the data better. New cases by county: Jefferson 276, Fayette 96, Bullitt 36, Hardin and Pike 34, Warren 33, Hopkins 27, Henderson and Kenton both at 26, Oldham and Scott 24, Madison 23, McCracken 21, Shelby 20, Boone, Christian, and Jessamine all at 19, Laurel, Lawrence, Rockcastle, and Whitley all at 18, Knox, Pulaski 17, Adair and Taylor 16, Campbell 15, Hart 13, Carter, Davis, LaRue, Marion, Marshall, and Perry County all have 12, Caldwell and Russell 11, and Boyle 10. And if that sounded like a long list, that's what happens when you have 1,300 cases. When we have a lot of cases, we also end up with more death. And so today we have lost 7 additional Kentuckians that will need your help, need your green lights, need your bells at 10 a.m. every morning. Today's include a 76-year-old man from Jefferson, a 49-year-old woman from Fayette, an 81-year-old man from Webster, an 82-year-old woman from Henderson, a 76-year-old man from Boyd, 78-year-old man from Franklin, and a 76-year-old man from Bullitt. A couple of the areas that we report on, long-term care facilities. We have 77 new residents, 58 new staff that are positive. 7 additional deaths are attributable to being in long-term care. 3 new facilities have had at least 1 positive case. All right, and sadly, today we learned that we have lost 2 veterans from our Thompson Hood Veterans Center in Wilmore that were at the Lexington VA. Those are now the 2nd and 3rd veterans in our veterans nursing homes that we have lost. Just another reason to make sure that we're doing everything we can to stop the spread of this, because the virus doesn't arise in one of these centers. It is brought into one of these centers. And none of the workers in the center would ever intentionally bring it in. And it didn't arise with them. Somebody spread it to them. And that person may or may not have intended to, but you can track that back, and it's decisions that are made that, if they're different, if they were safer, could have prevented now these 3 veterans from our veteran centers that we have lost. Kentucky Child Care Facilities, 8 new facilities with at least 1 positive case, 6 new staff, and 3 new children have tested positive. I think next up is our Lieutenant Governor, and then it goes over to Dr. Stack.
Good evening, Team Kentucky. I am here tonight to talk to you about the importance of healthcare. Certainly during a worldwide health pandemic, there is no better time to talk about making sure that everyone has healthcare. You know that this has been a priority of the Beshear Coleman administration to make sure that every Kentuckian has some kind of healthcare coverage, and you should be able to see a doctor when you are sick. That is certainly true for children. And so today I'm going to talk a little bit about the Kentucky Children's Health Insurance Program, otherwise known as KCHIP, because we have tens of thousands of kids right now in Kentucky who have no health insurance, and KCHIP can help to solve that problem. It is designed specifically for infants, children, and teens. And as a teacher, I can tell you that it doesn't take a rocket scientist to know that when kids are healthier, they learn better, and it impacts every aspect of their lives. You know, in other ways that it supports our families is it makes our families feel more secure because they know that they have health care and they can see a doctor when they need to. It certainly reduces their expenses, and we can all use help with that, certainly right now in the middle of a pandemic. But it also proves that it lowers a parent's stress level. So in addition to being good for kids, it's really good for families as a whole. We have seen the number of uninsured kids in Kentucky continue to rise. In 2016, we had 35,000 uninsured Kentucky kids, and then it rose to 40,000 in 2018. And so we definitely want to stop that surge and turn it into the other direction. So those numbers are disturbing. But the good news about that is KCHIP can help solve this problem, because with KCHIP, there is no cost and there is no copays. Your eligibility depends on your income, and those income guidelines are dependent upon the number of people in your household. So if you are a child's parent or guardian, you can apply, and that means grandparents, aunts, uncles, anyone can apply as long as they have legal custody of their child. So KCHIP covers a whole host of services that would be helpful to our kids. Doctor's visits, dental care, hospitalization, mental health services, which is something we always talk about, making sure that we are cognizant of in our kids right now as we are semi-isolated and more anxious with those mental health services. Lab tests and x-rays, hearing services, prescription medication, glasses, immunizations, which make sure that you get your flu shot. This is something that can help you with that. Physical therapy and speech therapy. So all of these things are covered by KCHIP, and I just want to make sure that everyone knows that if your child does not have healthcare coverage, then I urge you to learn more about KCHIP, and you can do that in 2 ways. The first is visiting the website, which is kidshealth.ky.gov, or you can call the 1-877 KCHIP 18, or that number is 1-877-524-4718. So make sure that you help to take care of your own health, but also work to take care of our kids' health as well. Next, I want to talk a little bit about the RISE Awards. Many of you are used to hearing me talk about public education and teachers in the classroom, but truly the unsung heroes of our education system are our school employees. And so we have partnered with the U.S. Department of Education to participate in the RISE Award, which stands for Recognizing Inspirational School Employees. And so this is an opportunity for us to be able to honor those hardworking school employees that work with our kids every day. That can be anyone from the clerical and administration staff that greet you when you walk in the office, to the food service workers that make sure our kids are fed, to the custodial workers that make sure that our schools are clean and sanitary, maintenance, transportation, and health services staff. So all of those folks can be nominated, and anyone can nominate someone who is a school employee for the RISE Awards. We are going to have a selection committee that will review those nominations and submit their recommendations to the governor, and then he will submit it to as our nominee for the Department of Education. So if you would like to nominate someone for the RISE Awards, if you know a school employee who demonstrates excellence in leadership and commitment and community involvement, you can visit education.ky.gov to make that nomination. And you need to do it soon because the nominations are due by 5 p.m. this Friday, October 16th. So help us to celebrate those hardworking school employees that are critical to our kids' lives and educations. Last but not least, I want to reiterate the importance of coverings for kids because the deadline is quickly approaching. First Lady Brittany Beshear and I started this initiative to collect masks, homemade or otherwise, for our students and our school staff. We want to make sure that everyone in our school community has the resources that they need to be safe, certainly during this pandemic. So we are providing these to schools at no cost to help alleviate some of the stress of finding face coverings during this time. So I encourage all of you as individuals or families or groups to get involved in this initiative. It's a great way to play a really important role in Team Kentucky and help protect our kids and the people that serve them every day in our schools. This initiative is running through the end of this month. So it is October 14th. And the deadline for this is on October 30th. So it is right around the corner. So if you would like to know more information about how you can get involved and provide masks for kids and teachers and school employees in your community, please go to firstlady.ky.gov/coverings for kids. Thank you so much. And now I'm going to turn it over to Dr. Stack.
Thank you, Lieutenant Governor, and good afternoon, everyone. I have a few things to talk about today. The first, James, could you please show my slides? There we go. So we are doing testing in a lot of different places. We have shown that information before. We're testing in Northern Kentucky in partnership with Gravity Diagnostics in St. Elizabeth's. We're testing in Louisville in partnership with Norton Healthcare and University of Louisville. We're also doing this in the University of Kentucky at Lexington. We also support testing at probably close to 40 hospitals and double digits health departments throughout the state. So we're providing a lot of testing to try to keep Kentuckians healthy and well. We have some new initiatives here, and those are the ones I want to highlight. We've worked with 4 of our health departments across different parts of the state, and they are rolling out testing to try to reach harder to reach and more vulnerable communities. And this is one of the central missions of health departments, is to try to help make sure underserved and disadvantaged individuals have access to quality health care just like everybody else. And so we're very grateful to share that the Purchase District Health Department, so this is down in the extreme southwest part of the state, the Ashland Boyd Health Department, which is up in the northeast part of the state, Kentucky River Health Department, which is in the southeast part of the state, and the Lincoln Trail Health Department, which is sort of, that's the more central or central west part of the state, are working with us to extend testing out to the communities. I put dates to the right there. Those are the dates the testing either has begun or will begin. And then going forward, hopefully through the end of the year, as long as we have CARES funding to support this. I know in Purchase District, they already have had multiple television news stories highlighting the great work they're doing, reaching individuals who had wanted to get tested but had difficulties and who they're helping. So thank you for the good work there. I had the chance to see their testing truck when I was down there visiting last week. So anyway, thank you very much to these health departments for your partnership. Our 61 local health departments that support 120 counties are a real crown jewel for the state, and despite the difficulties of chronically under-resourced public health, they have done wonderful work and clearly know and passionately care about their communities and the people that make the communities. So thank you very much. The next slide, James, please. I already talked at length about test positivity yesterday. I just used this slide as a placeholder to remind you these two lines are two different data streams that we use to calculate positivity. The blue line is the electronic data. That's about 55% or so of our total number of COVID PCR tests. The green line is the manual data. This is everything, the electronic plus the manual data that we get with episodic reporting sometimes via other sources. Because the electronic data stream is more reliable, more consistent, better quality, I would say, and we can automate a number of the processes. We're going to transition on Monday to using that methodology. I had a question from the media here on this. They were asking, will this calculation be confirmed cases via PCR tests divided by total PCR tests? I want to make a couple more clarifications, and we did say we would try to help the media understand this. Cases are not the same thing as positive tests. Cases are when an epidemiologist has reviewed the testing information and also the clinical information available, either provided by a doctor, a nurse practitioner, a health department, or talking to the patient themselves, and have confirmed that it is a positive case or a presumptive positive case, and opened a file and are maintaining the file. That's a case. Tests are just, did someone get a test and was it positive or was it negative? So there's a distinction there, but it has meaning. So we will use the PCR tests reported on any given day that were positive, divided by the total number of tests performed. And that's how we'll get this value. We will use the date the test is reported, but because we are automating this, the software will be able to screen out so that we don't include any tests that are more than 7 days old when they were collected. So the test positivity rate is intended to be a metric that helps us know, are we testing enough people currently, not 3 months ago, but currently. And so by screening out for tests that are collected more than 7 days previous to their report date, that helps us to ensure that this metric is a current measure of testing sufficiency. This will not change the way that cases are reported on the daily report. Again, cases are not the same as test results. The cases are reported when the epidemiologist has determined they are a confirmed or a confirmed probable case. And I make the distinction between confirmed and confirmed probable because when we use the antibody tests or the antigen tests, some of those remain probable unless they get a PCR test or meet other criteria that would make them a confirmed case without the qualification of probable. And then there were questions here about receiving case data by the day of test. We have not reported it by the day of test. We reported it only by the date the results are produced for when a person is determined to be a case. And we don't always have the collection date. Not every lab has consistently provided that. We keep working on that, but we don't report that. And then death data by day of death. We report the deaths when we have confirmed that they are COVID related. That's been our standard reporting methodology. We have done analyses to see the difference between actual date of death and the date we announce them. And it's my opinion and my belief that now that we are well into this, the trend lines tell a similar story. And so it doesn't add much more to chase all those different values. I would like now to, I think I'm going to make a mention about this. It may be on the governor's list, not mine, but I had a question come in from the media for Fort Knox dependent schools and whether they report or not to the state K through 12 database. That's something we'll look into. They're probably a military facility, and that because they're a federal facility, we'll reach out to them personally and discuss this with them. And then the last thing I wanted to mention, if you could show my final slide, James. got stuff here. So I asked you to write letters, and the governor teased me yesterday, and he said my new quote would be, "I have letters," and I do have letters. This is the stash that we retrieved from the Capitol today. So I don't compliment enough here all the staff we work with, and I'll say in this regard, this is the easiest thing she did today. But Kelly is the chief of staff for the Department for Public Health. She's the one who goes around and makes sure all those numbers the governor gives and that I often recite, that we have those, that those are accurate. And so she does incredible work helping us to come forward and talk to you every day. She went over and picked these up today, and apparently not long after she left, she got a call that there was a whole nother pile that arrived fresh today. I want to share just a few thoughts from these. So first of all, thank you. Thanks to all of you who wrote these. Obviously, as someone serving in a public office, it's really touching that people take the time to respond to an invitation to communicate, and I intend to read all of these. I didn't get through them all yet today, but I've read a number of them. I'm going to share a few buckets here. Concerns. People are hurting. People are worried about their businesses. They're worried about their health. They're worried about their loved ones. They're worried about their kids in school. They're worried about the disease. This is what we would expect, and it's unfortunate. This is the burden we have to bear with the pandemic, but that theme comes across. There are some other themes, though, too, and I'm going to continue along this concern. Some express that they believe it's their personal right and freedom to choose whether or not to comply with these measures. Others worry that folks aren't taking this seriously, and they're worried that they won't take it seriously until someone they personally care about gets seriously hurt or dies. I've got a few quotes, and the individuals gave me permission to mention these. One says, quote, "COVID concerns me as an LGBTQ male who saw too many die from HIV/AIDS in the 1980s. As the government remains silent, I'm concerned for my fellow Kentuckians who are frightfully similarly ignoring our current crisis." That was from Michael. Another one said, quote, "It concerns me too many are sick or have died because some have forgot about basic human kindness." That was from Debbie. Another said that they're, quote, "concerned because united we stand, divided we fall is our state model, and in the New Testament too. We are being tested, and I want our state to stand united to pass this test." That's from Betty. Thank you. There were some fears. I'm only going to mention two of them here. One says, quote, "I have an autoimmune disease. Catching the coronavirus would mean certain death for me." And that was from Dale. And I have another one whose name I won't give. They said they're a 60-year-old or 60-something-year-old parent with an adopted teenage child, and they don't want to leave that child motherless if something were to happen to them. And I think we can all relate to that fear. There were a lot of inspiring things, though. Lots and lots of people expressing gratitude for these daily briefings, for the governor, for the lieutenant governor, Secretary Friedlander, J. Michael Brown, the entire crew that has supported the governor, Rocky, and then, of course, for me, and we're very grateful for that. They appreciate these efforts to keep them informed and safe. Lots of people making personal sacrifices to keep their loved ones and their neighbors and their communities safe. I'm very grateful for that. And lots of expressions of support, encouragement, and prayer. I want to thank you all of these, even the ones that expressed opinions of frustration and differences of approach were constructive. They were thoughtful. And I would just observe that's the kind of dialogue we need as a nation and as a state. I think these folks, the way they communicated, demonstrate it's possible to look at a complex world and reach different conclusions, but it's still possible to care about each other, to communicate in a civil way, and to try to work through this. And so I really do believe, as the governor has said from the start, we'll get through this. We'll get through this together. And Governor, if you look behind me, someone brought me a plant now. They thought your picture would look better with a plant in front of it. So now we'll continue sprucing up that corner so that Governor Beshear has a proper presence here in the Commissioner for Public Health's office. So back to you, Governor. Thank you very much.
I tell you what, can we try to keep Steve still up on the screen? Let's just try to provide a little additional clarification on cases versus tests, which go into test positivity. So you tell me if I've got this right. A case is one individual who has been determined to be positive. Now, that individual could have had multiple negative tests before, or it could even have multiple positive tests, but is one person.
Correct.
Okay. And so for test positivity, and I apologize, I'm looking down where I can see the screen to see Steve, all of those persons' tests would go into our positivity rate because it'd be all the negatives and all the positive tests that have been taken.
Right. So the only qualification to that, if someone were to go get 2 tests in the same day, we only count them once per calendar day. But if the same person went and got a test 5 days in a row and there were 5 positives, each day they would be counted towards the positivity rate because they got tested and they were a different person that calendar day.
Right. And so the data streams are a little bit different. We get our number of cases as they come up through a local health department, or epidemiologists look at them, and that's when they start to be counted, and we make sure that they are getting the services or local health department that they need. The testing data now is going to come directly and electronically from labs as they do those testing without this other process, but would include potentially multiple negative tests for an individual over a significant period of time.
Right. And when you report cases, Governor, and I think this is important for people to know, you discuss a number of statistics. You say the number of new cases. People should know that is just one person with an acute illness. So we're not double counting. It's one person. That's why it takes a little time to make sure it's right. 2, when you give statistics about hospitalization rates or ICU rates or death rates, those statistics only count cases. That way we know that it's only one person. We don't double count the same person. And those statistics that way are very reliable for that purpose.
Right. Thank you, Dr. Stack. And I think one of the things that he mentioned that we also ought to continue to work on is our mental health. And maybe starting early next week, we can get back to providing tips, whether that's for kids that are still nervous about going back to school, or all of us, especially given the length of time that we've been dealing with. All right, only a couple of questions today. One is, what did you discuss on this morning's call with county mayors and judges, and how many of them were on the call? I think we had over 150. At least that's when I first got on what we had, and I know it was growing. I tried to provide as much information as I get from the state and from the White House task force. We went over national trends, state trends, testing, treatments, where the vaccines are and what the challenges are going to be, the logistics of getting it out when it is safe, the 2 different types. One requires a booster, like the hepatitis vaccine that we were dealing with, about 2 years ago, and one may be a single shot, that we shouldn't take too much out of 2 of these trials being momentarily stalled, because that happens and paused, and there have been effective vaccines that have had to go through that same pause. And then we made 2 major pushes that I know that those local leaders are working on. One is masks, and to continue to push and push and push, and the other is social gatherings. We're seeing a lot of spread by social gatherings that aren't 10 or less. There's a real good question by one of our mayors, and it turns out, I think the mayor of Coal Run doing a really good job in their community center. It was good to hear of all the steps that they're taking about the difference between something at, say, a community center, which has capacity and it's someone's home. A place where there is capacity has staff that are there to do the temperature checks, to ensure that people continue to wear masks. There is an enforcement mechanism there. The homes are different, and people let their guard down at those homes. If we can do those 2 things, and we can continue to be good about all of the other guidelines that are out there, I think we can stop this new escalation. Those are the 2 areas where I think we get the biggest impact, where we will see the largest reduction, or at least the best way to stop the escalation. Okay, I think if we still got Steve, this one is for him. There he is. This one's from Stu Johnson. Would hospitalizations with serious complications and deaths be reduced if more patients sought medical attention sooner?
It's a good question. And I'm not sure that there could be times when some people who got earlier care would be helped, because the medications that we use right now only get used on hospitalized patients. So yeah, if you are having trouble breathing, if you feel like you are really sick, go to the hospital and get checked out. Don't wait another day, because those treatments work better if they're given earlier. But if you're only mild to moderately ill, no, I don't think that going to the hospital sooner would reliably help you. It's one of those things you just have to use your discretion or judgment, or seek the opinion of your personal clinician, your primary care provider, and ask them what they think by the telephone if you need to, whether you should go in or not.
And Steve, if I'm still up, can you talk a little bit about how we have the mild cases, we have some asymptomatic, but we have others where people's condition seems to progress, can kind of stabilize, and then we've talked sometimes about day 10 or a certain time where we often see that somebody may have a more adverse impact.
Right. So this is a tricky disease because there's the infection with the virus, and then there's the body's immune system and how our body responds to it. And so some people get really sick, like you would expect with just the virus. When you get an infection like the flu, you know that you can get a fever that's really high and feel achy and exhausted, and you just feel terrible. That's the acute virus and the infection and your body's immediate response to it. COVID-19 has this kind of other, I don't know what to call it, this other aspect to it where people can seem to be stable or do okay, and then about 8 or 9 or 10 days into the illness, just suddenly and severely decline. And so that's where people worry about what happens later in the illness and why you're really not out of the woods until you're a couple weeks past the beginning of this infection. And then we know that it's even more wily than that, because what we've seen in some of the children and probably some of the adults who have prolonged heart problems, or maybe this 10% that could have a prolonged syndrome that they're calling long haulers, probably your immune system responds really strongly and continues to cause your body problems for weeks or even months afterwards. And that's something we do not understand very well yet.
All right. Thank you to Dr. Stack and the Lieutenant Governor for joining us tonight. I just want to end with a special thank you to all those who are out there day in and day out trying to not only do the right thing, but who have jobs that require them to try to get other people to do the right thing. So to our local health departments, to those that may be sitting in front of grocery stores and other areas, asking people to wear their masks, thank you. I know it's not comfortable. I know it's not easy, but it keeps everybody inside safe and ensures that your place of business isn't one that is spreading the virus. To the local health department folks, I know we've never been asked to do things quite like this, and you rarely hear the positive. You end up hearing the other. Thank you so much. And these are not folks that anybody should be yelling at. They didn't make these decisions, though I know they believe in them. And while some people may think that it's their right not to wear a mask, no one has a right to yell and scream and threaten somebody with violence. If you get to that last part, you're breaking the law, and that's not your right as an American citizen. So be kind to each other. Even if you're fired up about something, it is not that individual's fault, and we don't get to be selfish and take our anxieties out on other people. And this calls on us to be good people, really, really good people. But I'd like to think each of us thinks that we are or have the potential to be a really good person. So it's time for us to step up and make sure that we are treating everybody else with kindness. Nobody gets an excuse to be a jerk. Everybody is nervous, maybe even a little afraid, uncertain about the future. Maybe there's more uncertainty right now than there's ever been in many of our lifetimes, but everybody else is going through that too, even if they don't agree with you on certain things. So we claim to love to be Kentuckians and love to be Americans. Well, let's act like them. And let's make sure that we are doing the right things each day. But don't let that cloud that I know so many people out there want to. And for everybody, put on your mask, engage in social distancing. Today, with over 1,300 cases, ought to convince us that we got to do a little better. But I know we can. We've stepped up to the plate twice and stopped the escalation. We can step up a third time. This virus will end. It's just going to take as long as it's going to take for us to defeat it. Let's continue to write a positive chapter in our history here in Kentucky, where we lead, whether that's the country, whether that's the right direction for each other. Let's just get it done. We'll see you tomorrow at 4. Thanks.